So today I'm going to discuss about the heart failure. So the heart failure is basically the cardiac pump dysfunction which lead to the low tissue perfusion. Heart failure may be classified into the different ways. I am going to discuss about the important classification of the heart failure. So heart failure may be classified into the systolic heart failure and the diastolic heart failure. In the systolic heart failure, the ejection fraction of the heart is reduced, while in case of the diastolic heart failure, the ejection fraction remain normal. So, next important difference in about the most common cause of the systolic heart failure is myocardial infarction. While the diastolic heart failure is also due to the myocardial infarction as well as myocardial hypertrophy. So it's myocardial hypertrophy. While the systolic heart failure has and diastolic volume is increased and diastolic volume. And diastolic volume mean the filling of the heart, and while in case of diastolic heart failure and diastolic volume remain normal. Systolic heart failure S3 sound is more prominent, while in case of the diastolic heart failure S4 sound is more prominent. Now I'm going to discuss about the right-sided heart failure. The right-sided heart failure is basically the right ventricle pump failure, and the most common cause of the right side heart failure is left side heart failure. It may also arise due to the pulmonary cause. So the isolated right side heart failure due to the pulmonary cause, and this pulmonary cause that lead to the right side heart failure is known as core pulmonale. The core pulmonale is a terminology that when the pulmonary cause lead to the isolated right-sided heart failure. Left-sided heart failure means left ventricle pump failure. Left ventricle failure. So the right-sided heart failure present with increased GVT, peripheral edema, peripheral edema, and last one is hepatomegaly. Hepatomegaly means enlarged liver, while the left-sided heart failure present with orthopnea, paroxysmal nocturnal dyspnea, and pulmonary edema. So the hallmark of the left-sided heart failure is increased left ventricle and diastolic pressure, which is a hallmark of this disease. Left ventricle and diastolic pressure or volume. So the acute heart failure patient is usually symptomatic, while chronic heart failure patient is usually asymptomatic. So now I'm going to discuss about the pathophysiology of the heart failure. So what happened? Because it's the pump failure which lead to the decreased cardiac output. When the cardiac output decrease, it will activate the renin-angiotensin aldosterone system. Renin-angiotensin system lead to the two things: increase angiotensin 2 and aldosterone. And so, uh, and angiotensin 2 and ADH. So this both of these are the vasoconstrictor. So they lead increase arterial tone and increase venous tone. Venous tone lead to the increase venous return, which lead to the increase volume returning to the heart and which lead to the increased stroke volume. So the vasoconstriction effect of the angiotensin 2 and ADH through the V1 receptors and angiotensin action through AT1 receptors. AT1 receptors. So it will lead to the increased blood pressure. So in this way, no. So angiotensin 2, aldosterone and ADH, they lead to the increased circulating volume by reabsorbing water. Reabsorbing water. This cardiac output also activates the sympathetic system. Sympathetic system leads to the increased release of the catecholamine, epinephrine, and norepinephrine. This catecholamine lead to the increased contractility of the heart, which lead to the increased stroke volume and increased heart rate. So this decrease in cardiac output lead to the two changes: increased sympathetic activation and increased renin angiotensin aldosterone. These things are in short time and acutely are beneficially to the heart, but in case when these things goes on chronically, it will ultimately lead to the deleterious effect on the heart. So, if you understand the pathophysiology of the heart failure, so now I am going to discuss about the class of the drug that used in the chronic heart failure. So, first drugs is that block this system, renal angiotensin aldosterone system. There are two drugs, angiotensin converting enzyme inhibitor, and second one in angiotensin receptor blocker. So another drug that block this aldosterone action is aldosterone antagonist like spironolactone. So ACE, angiotensin receptor blocker, and another drug that block this sympathetic system is beta blockers. So all of these drugs, beta blocker, aldosterone receptor antagonist, ACE, angiotensin receptor block, all of these four drugs reduce mortality in the heart failure patient. While the acute heart failure treatment I will discuss in the next few slides, but the acute heart failure, the treatment is basically the symptomatic. The symptomatic drugs are basically loop diuretics, thiazides, and last one, nitrate. So these three drugs are basically used for the symptomatic relief the patient in acute heart failure. So these drugs are used in acute heart failure.